starting my recording of her. Oh, that's really bright. Okay, so I'm going to scan the room. So I just recorded myself. We got the walls. All our stuff is just kind of sitting there. Here's Hailey Hershey. There's Barbara. I don't have anything on the ceilings. Okay, we're not hiding anything.
Expose her.
Sorry, Barbara. Okay, and then over here, like nothing on the ground. These are just the supplies we're gonna be using. Okay.
This is Dee's old supplies.
Yeah,
I'm not
these are
using that.
my old supplies.
No
Nothing
bags.
there. Yeah. Okay. I think we're ready to go.
Okay.
We did it.
Ready?
Yep.
Okay, so before I come in the room, I'm gonna make sure I have all my supplies. I've checked my orders and everything. I'm gonna go ahead and come in and enter, not close the door for privacy, introduce myself. Hello, I'm Hailey. I'm gonna be your nurse today. I'm gonna get 2 identifiers, your name, your date of birth, and your address and your name. Great, Barbara. Okay, I'm just gonna go ahead and wash my hands quick. And then I'm gonna be explaining to you what we're doing today. So today we're going to be putting in a catheter, collecting a specimen after the catheter's been in for a while, removing it, and putting in an NG tube for you. Does that all sound okay? Have you been talked to about this before? Yes? Okay, great. And I just want to make sure that I have your consent to go ahead and start the catheter, because we are going to be working with your private areas, and I want to make sure that you're comfortable with that. Yes? Okay, great. So before we begin, you don't have any allergies at all or anything like that? Have you had any facial trauma, a broken nose, face surgeries, anything at all? No, and nothing I should be aware of before we begin the catheter? No? Okay, great. I don't remember if I did this, but I'm going to wash my hands again. I'm going to go ahead and put on some gloves. Okay. I'm going to grab what I need for the catheter. Let's go ahead and bring this around here. That's like an ankle. Oh. Okay, first I'm going to raise your bed up to a good height for me. Okay. Okay, Barbara, so I just want to make sure one more time that I have your consent to do this because of the area we're going to be working in. Yes, I do. Okay, great. I'm just going to go ahead. I'm going to come down and expose this area here. I'm going to pull this up and let me know at any time if you want me to stop, and we'll go ahead and stop and figure something else out, okay? Now just go ahead and raise your legs, okay? And my sterile gloves are like in the sterile thing, but I can't have them in there. So I'm going to take the wipes here from the package that aren't sterile yet, and I'm going to go ahead and start cleaning, okay? So we're going to start here on the inside, and I'm going to spread right here, and we're going to wipe down right here and down the middle. We're going to throw that in my hypothetical garbage. Okay, we're going to go outside of the lips right here. We're going to throw that away, and then we're going to go out on the outside right here and make sure that you're all nice and clean, okay? So while we're doing that, I'm going to remove my gloves, throw them away. Throw them away. I'm going to wash my hands again, use hand sanitizer. I'm going to open up my catheter package. I'm going to throw that away. Okay, so the inside of this is sterile, so I'm going to make sure not to touch it. And I'm actually, without touching the inside, I'm going to move it here. Now, Barbara, I wanted to tell you that this is a sterile procedure, so I need you to not move if you can, please, or move as little as possible. So taking from there, I'm going to go ahead and sanitize my hands one more time, and then I'm going to grab my sterile gloves. So open these. Okay. So I'm gonna go ahead and go in here, making sure that I am staying as sterile as possible. That was a terrible job. Okay, so now I'm gonna go ahead. Okay, I broke sterile field, I'm just gonna say, and restart this. I'm gonna grab a whole new catheter kit and everything. Barbara, I'm severely sorry for this inconvenience, but sterile field is broken, so we have to start over with all new clean supplies. Okay, so we're gonna say that I got a whole new kit.
Wouldn't it just be have your gloves that was just the gloves that you didn't touch that? Yeah, so just get new gloves. You're good.
Kit is good, Barbara. We're not getting a new kit. I got a new pair of sterile gloves, and now I'm gonna redo the procedure and hopefully do it better this time. I'm gonna go ahead, take my glove, get it on. Now I'm gonna go this. Okay, so I have my sterile field. So this is sterile and now this is sterile. Barbara, please remember to move as little as possible or to not move at all. I'm gonna go ahead and get rid of that. Okay, I'm going to take this drape right here and I'm going to go ahead and place this under you just so everything stays good, and I'm going to maintain sterile field and just press it under right there. Okay, I'm going to go ahead and take this piece right here and I'm just going to drape it over you here in the middle while still maintaining a sterile field. And I'm not turning my back to my sterile field at all, it's always in sight. Okay, so now I'm going to go ahead and just kind of space out my supplies. So I'm going to take my syringe, uncap it. I'm going to take my catheter here. I'm going to find the orange tubing. I'm going to go ahead and push that in. Get that to all lay nice. Now I'm going to go and take my lube. Take this off there. And I'm going to go ahead and squirt some lube. Squirt some lube in. I'm going to remove this here and I'm going to throw that away. I'm going to lay the tip of the catheter into the lube here. Make sure it stays in there. Okay, so now I'm going to go ahead and clean you a second time. So I'm going to take these wipes, these swab sticks, and I'm going to clean you again. So now I'm going to make my non-donut hand my non-sterile hand. So I'm going to go ahead and open the lips, and I'd clean inside of the lips with the first swab and throw that away. Then outside of the lips with the second swab and throw that away. And then all over out here with the third swab and throw that away. So these are all gone. And I'm going to go ahead and set my specimen container outside. Okay. Are you still feeling okay, Barbara? Yes? Okay. So now we're going to go ahead and we're going to start by inserting the catheter, okay? And after I cleaned it, I wouldn't have let go of the lips. I would still be holding them. So I'm going to go ahead and take the catheter. I'm going to find the urethra and we're going to go up inside of it, okay? And this is to, I would have told you this before I'd even done any of this. This is to drain your bladder, okay? and we're gonna get a specimen from it, make sure everything's all good, and it's gonna go up through your urethra and sit inside of your bladder for a while, okay? So we're gonna go ahead, find the urethra, we're gonna go up inside of it, right here. So now I'm going to stabilize it with this and insert a little bit of water into the balloon so that way it inflates, and I would go in until I found urine, saw urine come back, and then go up 1 or 2 more inches. Okay, I'm going to go ahead and remove this, rid of this. Now that the balloon's inflated, I'm going to tug a little bit to make sure it's sitting snugly, which it is. Great, so now I'm going to go ahead and take the bag, and I'm going to drape the bag below. I'm going to take a securing device, Velcro thing, what we don't have, and I'd secure that to the leg. I'm going to remove this here. Take this away, throw this away. And now I'm going to go ahead with another set of wipes. I'm going to go ahead and just re-clean everything once again. So inside of the lips, outside of the lips, and down the outside here. So now that's all good. I'm going to remove this here. I'm going to go ahead and take off my gloves. Right here, I'm going to cover this. I can get rid of this now. Right here. Okay. We're going to cover Barbara back up. Hey Barbara, are you all good? Are you feeling okay? Any pain at all? No, you're feeling great. Okay, I'm going to go ahead and lower you down. I'm not actually going to lower you because you take a long time, so lift up. But I would lower you down to the lowest setting, and I'd give you a call light. And I'm going to go ahead and leave now, and I'll come back in a couple of hours, and we're going to take a specimen a sample of your urine. Okay, so I'm going to go ahead and leave. I'm going to throw away all my supplies that I do not want. Such as this.
Oh, we forgot to get this.
Okay,
Okay.
so I'm going to go ahead, leave the room, and I'm coming back now. I've had her catheter clipped for 15 to 30 minutes. It's been clamped, so I'm going to come back and get my specimen. So I'm going to knock again, come back in. Hello, it's me again, Hailey, your nurse. Can you please tell me your name and date of birth? Great, Barbara. Okay, like I said earlier, we're going to go ahead and be taking a specimen or a sample of your urine now, okay, from your catheter. Does that sound okay? Yes, okay, we're going to use this to get it sent down to the lab to be analyzed so we can figure out kind of what's going on. So I'm going to go ahead and wash my hands, perform hand hygiene. I'm going to grab some gloves to put on. Okay, I'm going to grab supplies that I need here. I have my specimen cup. Okay, so I'm going to come back here, Barbara. I'm going to go ahead and expose your leg if that's okay. And I do have your permission to do this, correct? Yes? Okay, I'm just going to pull this off to the side. We're going to come right here. It's secured. I'm just going to check the catheter, make sure everything looks good, nothing's wrong or irritated. So, like I said, it's been clamped for 15 to 30 minutes already. I'm going to go ahead and open up my specimen cup. I'm going to take an alcohol swab, dispose of it. I'm going to wipe down the port that I will be using right here. Dispose of that. Now I'm gonna take a new syringe that I have right here. I'm going to get a new syringe from a different bag. And I'm going to withdraw 5 to 10 milliliters of urine, okay? So I'm gonna go ahead and put this in here, and I'm going to withdraw 5 to 10. I have 10 milliliters right there of urine. So I'm gonna go ahead, squirt this into the cup, dispose of this per the facility's protocols. I'm going to twist this on, unclamp, to remove my gloves and get some hand sanitizer. I'm going to go ahead and cover you back up, Barbara. We're all done with that now. I'm going to go ahead and take the specimen and label it with my name, date, time, all of the instructions. And before I'd done this, I would have double checked the doctor's prescriptions and stuff. Okay, so I'm gonna go ahead and send this off to the lab. And now I'm going to leave Barbara again, make sure that she's still comfortable, you're not in pain at all. I'd lower her to the lowest setting in the bed, make sure her call light is within reach so that she's comfortable. And I'll leave and come back in a few hours again. Before I do that, this is going off to the lab. I'm going to get rid of the supplies that I don't need right now, I just used. Okay, so now I'm going to come back in a few hours. I'm going to go ahead and knock. Hello, I'm back again. It's Hailey, your nurse. Can you go ahead and give me your name and date of birth, please? Okay, great, Barbara. Now we're going to be inserting an NG tube to you on you today. Does that sound okay? So it's going to go in through your nose, down through your throat, and into your stomach. And we're going to use it to get samples of gastric juices, to do decompression of your stomach or for feedings and stuff like that. Does that sound okay? Do I have your consent to do this? Yes? Okay, great. I'm going to go ahead and lower you a little bit and then raise you up to a 45-degree position. Okay, great. I'm going to go ahead, perform hand hygiene, grab a set of gloves, I'm going to grab all of the supplies I need. Come over here. Okay, Barbara, we're going to go ahead and test your nose quick to see what side we're going to put the tube down. So if you can plug one side and breathe in, do that on each side. And you pick your left side to have the tube go in. Okay, great. So I'm going to go ahead and lower this. And I'm going to place this across your chest right here. I'm going to get my tubing, I'm going to get this, and I have some lube here ready too. I'm going to fill you up some water with a straw for you to drink. I'm going to pull out the tube, and I'm going to go ahead and measure it against your face. Is that okay? Yes? So I'm going to measure from the nose to the base of the ear. And that is 15, so I'm going to make a mark there. Now I'm going to go from 15 down to about, I don't know, upper part of the chest, and it's about 51. So I'm going to make a mark there, and I know to stop pushing it when I get to 51. So I'm going to go ahead and put some lube on the tip of it so it can go down easier. Now you may experience gagging and coughing along with this. That's going to be okay. I encourage that. And we'll go ahead and stop if you want us to. Remember, you can tell me to stop at any time. I'm going to watch for if you're turning blue or anything, and I'm going to go ahead and make sure I stop the procedure, okay? So I'm going to go ahead and have you tip your head back for me, okay? And take a drink of water, and I'm going to insert the tube. Okay. And then once I meet resistance, I'm going to go ahead, have you take another drink of water and tilt your head down like this, and I'm going to push it in the rest of the way. And we're going to 51. Okay, I'm going to make sure I mark this section right here. And if I have temporary tape, I'm going to temporarily pin that there and make sure it's pinned with tape to the shirt. I'm going to remove this. Are you feeling okay? Yes? No? So we're going to go ahead and remove this. We're going to perform some oral care on you too. Just get it all cleaned up in there. I'm going to go ahead and take the syringe, and now I'm going to pull back and aspirate some gastric juices so we can test it on a pH to make sure we have it in the right spot. So I'm just going to go ahead and pull back, and I test it on my pH strip, and yes, we are in the correct area. I'm going to call down to X-ray and ask if they can come up stat to take an X-ray for us. They did come up, they took an X-ray, everything's in the right place, and if the doctor orders it, I'll go ahead and hook this up to the suction canister here and everything as such, and I'm going to go ahead and place a barrier cream and tape it down with more permanent tape here along the nose that we don't have with us right now. And I'm going to go ahead and leave and come back, and we're going to take that out, okay, Barbara? Does that all sound good? Yes? Okay. I'm going to get rid of the supplies I do not need. What is this? Okay, so I'm going to leave. I lower her to where she's comfortable, make sure she has her call light. I'm going to come back. Hello, Barbara. It's me again. Now that I've identified you by name, can you give me 2 other identifiers? Great. It is confirmed that you are Barbara. We're going to go ahead and remove your NG tube. Does that all sound okay? Yes? Okay, we're running out of gloves, so for this purpose, I'm going to wash my hands, put on a new pair of gloves. Okay, Barbara. So we're going to go ahead and be removing your NG tube today. So I'm going to go ahead and put this way on your chest. I'm going to unconnect it. If it's connected to the suctioning, I'm going to go ahead and record and document the amount that came out from the suctioning canister here. Make sure that this is down. I'm going to provide her with a, I don't know, kidney bean bowl in case she pukes. Okay, Barbara, how are you feeling right now? Are you feeling okay? Yes? Okay, great. I'm going to go ahead and pull the nose strip off of her. Okay, and I need you to go ahead and take a deep breath and hold it, and I'm going to pull out your nasal, your NG tube. Is that all okay? Yes? Okay, great. So ready? 1, 2, 3. I'm going to not do that yet. I have this little rag here that I'm going to use under it to help make sure nothing dribbles on you. So ready? 1, 2, 3. Deep breath in. We're going to pull. 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 Great job. I'm going to check that the tip is intact of it. I'm going to wrap it up in this thing, and I'd go ahead and dispose of it per the facility's protocols. I don't have a tissue, but if I did, I'd go ahead and clean up her nose for her, make sure everything's good. She didn't puke. Great job, Barbara, way to do that. So I'm going to go ahead and take this. I'm going to make sure I provide oral care to her and that nothing's on her and that she's all good and clean. I'm going to take this way. Okay, and that's all disposed of per the facilities protocols. Okay, Barbara, we're going to go ahead and remove your catheter now at the same time. Is that all okay? Yes? Okay, great. Come back around to the side. Now I'm going to lay you down flat and elevate your bed. And I would put that bed rail up. Okay, Barbara, we're going to go ahead and remove your catheter. Is that okay? Okay, great. I'm going to go ahead and pull this down. And I'm just going to go ahead and check the area, make sure that everything looks good and everything does. I'm going to have like wipes here and this. I'm going to have wipes and a cloth for this. Okay. So everything looks good, there's no breakdown, no drainage, nothing at all like that. I'm going to take the urinary bag and I'm going to go ahead and empty it into a urinal so that way I can measure how much output she's had compared to her input. I'm going to unstrap this from her leg with the secure thing. I'm going to make sure her legs are here in the right position. I'm going to place this under her here so nothing dribbles out. Okay. Oh, that wasn't supposed to happen. Okay. And I also would grab a syringe to deflate the balloon. So I'm going to stick this in. I'm going to deflate the balloon, pulling out the air. I'm going to get rid of that, dispose of that per facilities protocol. So now that the balloon is deflated, we can go ahead and pull it out, okay? On the count of 3, I'm going to go ahead and pull it out. Okay, ready? 1, 2, 3. So we're going to pull it out all of the way. And I would make sure to dispose of this per the facilities protocols, probably in a biohazard bag. I'm going to take my wipe here and I'm going to go ahead and clean you off again, Barbara, okay? So I'd clean from the inside and work my way out. So inside the lips, then outside pubic area. I'm going to put that here. Go ahead and discard this, and I would discard my gloves too. And I would have changed gloves in between getting rid of her NG tube and getting rid of the catheter, but we're short supplied on gloves, but I would have done that. I'm going to go ahead and cover you back up, Barbara, make sure you're comfortable. Cover you back up all the way. I'm going to go ahead and lower your bed all the way. Make sure your call light is within reach. Make sure everything is disposed of. I'm going to go ahead and document everything here that happened today, such as inserting your catheter, taking a specimen from it, removing your catheter, inserting your NG tube, and removing your NG tube. Just go ahead and put up your bed rail. Is there anything else that you need from me, Barbara? No? Okay, great. Have a great day.